The Rundown with Carrie Saldo podcast is funded by Armbrook Village Senior Living in Westfield, with support services designed to help seniors age in place, including a Compass Memory Support Neighborhood. More at armbrookvillage.com.
This is The Rundown, your weekly news and review from Western Mass. I'm Carrie Saldo. It's Friday, July 19th, 2024. Our news hounds this week: Greta Yoakum from the Springfield Republican newspaper, investigations editor; Hampden County Sheriff's Office Senior Public Information Officer Rob Rizzuto; and Peyton North, executive editor of Reminder Publishing. Good morning, everyone.
Good morning.
Morning.
Coming up later in the show, we will discuss the pros and cons of a mobile methadone clinic serving a so-called treatment desert here in Western Mass, the latest on the $71 million effort to restore the Victory Theater in Holyoke. Hey, listeners, you can email us your favorite Western Mass historic venue. Any thoughts bubbling about this week's news, the rundown at nepm.org. But first, for those perhaps vacationing last week on the moon, most likely, let me be the first to tell you that it was an historic week in our nation. Unsettling events on Saturday following an assassination attempt on former President Trump, and now, as of last night, newly minted GOP presidential nominee Donald Trump. His ear was grazed by a bullet at a campaign event Saturday in Butler, Pennsylvania, where a spectator was killed and two others were wounded. The shooter was killed by the Secret Service. Last night, President Trump called for unity at the RNC, among other things, during a sprawling 90-minute nominee acceptance speech. I think that had all Oscar musicians sort of nervous at the length of that speech. But he said that he wants to be president for the whole country, not just 50% of the country, speaking to that unity bit. Since Saturday, though, we've seen additional angst and polarization, serious questions about the Secret Service coverage of the event. I think it's safe to say, wild conspiracy theories from both Democrats and Republicans alike about the shooter's motive, and yet no clear motive reported by federal investigators. Hey, Rob, if the Secret Service, their public information officer job becomes available, you'll be first in line, right? It's a great time to be with the Secret Service.
No, thank you. A lot of mistakes there to explain away.
Well, yeah, more to the point, my question here this morning for you, your current position with the Hampden County Sheriff's Office. Before that, you worked in journalism, recovering journalist, recovering political junkie. Where are you standing in all this?
I watch it all from the periphery. Being a former politics reporter, I'm a registered independent. I really look at the individuals, and in my house, that's how we kind of make our decisions about who to vote for. So I take a kind of non-traditional view of politics, and I'm just kind of watching it all unfold. I think that based on how the Democrats have played their hand since 2016, in Hillary Clinton's initial run, I think they have set this up for Donald Trump to initially become president, and now with President Biden's age and some of the issues that we're seeing that are really being persistent, it is what it is, as they say. And I think that based on the past week and the superstar show at the RNC over the past couple of days, the Republicans have really capitalized on the moment, and they have kind of, in the public perception, become the fun party and almost the party of everyone.
And also a unified party, right? I mean, we saw numerous people, a never Trumper who's going to be the vice presidential nominee. Lots of surprises this week. And we actually had a photographer there at the RNC, Barry Goldstein, a correspondent for NEPM, who spoke with delegates, and many of them from Massachusetts, including Dr. Elizabeth Hines Farrick. She's a delegate who lives in Boston, and she spoke about her support for Trump's stance on immigration.
We have to secure the borders. We have to, for the sake of the American citizens and Americans. I believe that it should be legal immigration, because I myself am an immigrant. I'm a naturalized citizen. I'm originally from Guyana, South America, the only English-speaking country in South America. So I am an advocate for immigration, but it has to be done in a way that where it is structured.
And here's one more, Michael Valenzola, who's another delegate, and he is from the Western Mass town of Wales.
We got to really take a step back and separate approach from outcomes. Donald Trump does have an unorthodox approach. He absolutely is unconventional in how he, tackles things and some of what he says. But over the course of his tenure, the outcomes were pretty good. Generally speaking, economically, we were in a good position. We didn't see new wars starting up. We were, I think, respected at the level that we should have been respected across the globe. And so, if we can try to separate approach from outcomes, I think that we'll find ourselves, hopefully, in a much better place over the course of the next 4 years.
Fabulous scene setter audio there at the RNC in Milwaukee. Greta, you're from Milwaukee. Have you been watching this sort of with bated breath, with careful attention? Or are you just glad you're not in Milwaukee right now?
It sounds busy for sure. Yeah, I'm from a suburb right on the edge of the city, so it has been particularly interesting for me to read the news and see this large event unfold in my hometown. Yeah, very interesting.
And we also heard, as I said, this week, some huge news with J.D. Vance, the Ohio senator, becoming the vice presidential pick, and tons of other news coming out of the RNC this week. Also, though, on the Democratic side of the race, more Democrats calling for President Biden to drop his bid for the 2024 race for the White House. Obviously, that debate performance, which was not stellar, is still sticking with him. And then last week, Massachusetts Congressman Jim McGovern, who we heard here on this program, he told the fabulous 413 that he was keeping his powder dry relative to Biden. But this week, that powder is wet. Is that the opposite of that saying? I was thinking about it. I'm not quite sure. Either way, here's what McGovern told the fabulous 413 this week.
It seems to me that indications are that he would step aside.
And then McGovern went on to say this.
I think Biden, if he stays in, needs to demonstrate to people and to the doubters that there is a pathway to victory. And if there is not, then he needs to step aside for the sake of the country.
Now, Biden has insisted that he has absolutely no intention of stepping aside. But, Rob, if you pulled out your crystal ball, where's this one heading?
So I think that what we're looking at is in the next week, you're going to see President Biden probably step aside. I think the fundamental problem with that is that, as you mentioned, the Republicans have a unified party, a unified stance, and currently they're the party of fun, the party of America. The Democrats are very fragmented. This day was coming. Everybody knew it 4 years ago, except for the old guard of the Democrats who failed to cede power back then. And that's why Kamala Harris has had no profile over the past 4 years. Like she's been kept in a closet. So even if you swap her out at the last minute, I think it's a fruitless endeavor because the Democrats have played their card in such a way where Nancy Pelosi, where Joe Biden, where the old guard was not building a bench, where if you look at the Republican side, now you have Donald Trump picking J.D. Vance. He's 39.
Superstar of the Republican Party.
Yes.
Yeah. Certainly tons more to come on all of this. We will keep you informed here at NEPM. On to some more closely local news. A headline this week, Behavioral Health Network launches a mobile methadone clinic, the only such facility in Western Massachusetts. Peyton North, the Reminder, reported on this, among others. The Behavioral Health Network, which operates the mobile clinic, told your reporter, Mike Dobbs, also a friend of the show, that they're starting in the rural small town of Ware for a very specific reason. Why are they looking at Ware, Peyton?
Where is a desert for this kind of treatment? Palmer as well. If people need to go and get treatment for this, they're having to go to Springfield, they're going to Worcester, they're going even further. So this is filling a void in those communities. In 2015, Ware had one of the highest opioid death rates. Those statistics have changed a little bit, but they're still high. So this is providing a service that's really necessary to the communities.
Yeah. The organization Behavioral Health Network heard from the community. In fact, I think I read it in the Reminder that members of the area or just feel like they're facing an uphill battle when it comes to this, right? Public transportation, as we know, across Western Massachusetts is not the easiest to navigate. And so getting from Ware to Springfield or someplace closer that does have these life-saving medications, as Dr. Ruth Potee pointed out in the reporting, just harder to get access to. Rob, I read a stat on the Hampden County Sheriff's website that more than 80% of incarcerated individuals are struggling with substance substance use disorder, which methadone is one of the things that's used to treat that. Hampden County's approach to that has been to use methadone or other such medications for treatment. But I think some could look at that and say, well, wait a minute here. We're incarcerating people because they've used drugs or a similar substance, and yet they're being given a substance. What's going on here?
So that statistic is correct. At this point, it's between 80 and 90% of all incarcerated individuals in our care and custody have some level of substance use disorder. In 2019, we launched a medication-assisted treatment program, which was revolutionary in the Commonwealth of Massachusetts. Basically, we offer the 3 FDA-approved medications for treatment to individuals that qualify for the program. Since its inception, we've had 4,000 people that we have taken care of through MAT. Now, people say that it's, the critics would say, oh, you're changing one drug for another, but the truth of the matter is what these drugs do is help people stay sober, stay on the path toward long-term recovery, and quite frankly, avoid an overdose, which in too many cases is fatal. So, and in the long term, medication-assisted treatment coupled with good, viable, robust therapy can help a person transition from substance use disorder to long-term recovery. And in many of the cases that we've seen within our correctional institution, those people actually go on to become recovery coaches and become mentors to their fellow citizens who are also struggling with addiction-related issues.
No, Robbie, you perfectly teed up a story for me that Greta reported on, and it was in both in print and posted to the Mass Live website in print in the Republican this morning. Greta, you spoke with people who are in recovery, women who are in recovery. They're prescribed methadone. They're using methadone, and yet they're also getting in trouble for using that medication. What's going on?
Yeah, so one big issue is women, people who are pregnant and use methadone or Suboxone or any other drug to treat substance use disorder, opioid use disorder that is also an opioid. There's a state law that says in the mandated reporter law, the way that it's written is kind of largely interpreted as when you give birth and your child is dependent on a substance and being harmed by that, that they report you to DCF for possible neglect. They're supposed.
That's the Department of Children and
Yes,
Families. That
exactly. Yeah,
state
and that's
agency.
Really scary for people and parents and women to face that scrutiny. It can lead to people deciding to take the medication, consider that, and there's some state legislation and federal legislation looking to make some changes.
And 2 Boston area hospitals have already made an adjustment to their policy, right?
Yeah, Boston Medical Center and Mass General Brigham. And Mass General Brigham is also, it's the whole system, so Cooley-Dickinson in Northampton is included in that. I talked to a woman who's going to give birth there in about 6 weeks, who's on medication-assisted treatment.
So any indication if the legislators will take this up before the July 31st deadline, which is clicking ever closer?
You never know. Senator Comerford, Joe Comerford of Northampton, who's been behind this, says she's pushing for it. But we know there's a lot of different types of proposals and issues the legislature is looking at now, and the clock's ticking.
And currently, this is a mobile van, Peyton, but it is staying stationary in where, at least for the moment. Any indication on if it will actually become mobile and maybe move to Palmer, which also does not have as ready access to methadone as, say, Springfield or larger areas?
Yeah, I have heard that it is going to be, so they have certain hours and dates and times that they're in where, but I have heard that they're looking to make it a little bit more mobile, stay in those communities. But something that was interesting that the senior vice president said and told Mike Dobbs was people think that this is a city issue, opioid death. A lot of people just equate it to, oh, it's in the cities, when really it's a small town issue because of the lack of the access.
Well, we'll certainly keep watching it here on The Rundown, and there's certainly more to come. Stay with us. We are going to take a quick break, but when The Rundown returns, 2 different Western Mass nursing homes are facing allegations that they neglect patients and provide poor care, among other issues. What's being done about that? We'll talk about it. And can the planned reopening of the Victory Theater in Holyoke have a similar economic impact to Tanglewood in the Berkshires? We'll also ask the panel about that. Our Rundowners will tell us what they think. You can tell us what you think at therundown@nepm.org.
You're listening to 88.5 NEPM, NPR News and Local Perspective for Western Mass. The Rundown with Carrie Saldo is funded in part by Armbrook Village.
Welcome back to The Rundown here on NEPM. I'm Carrie Saldo along with Peyton North, Rob Rizzuto, and Greta Yoakum. Let's dive right back in, panel, shall we? 2 nursing care facilities were in the news here in Western Mass this week. First, 2 of the 10 most fined nursing care facilities are in Western Massachusetts. Greta, you reported on this for the Republican and Mass Live. The headline just heartbreaking. "A dog pound would be better," is the quote there, inside of one of the most fined nursing homes in Massachusetts. Lest we leave you in suspense, that nursing home is Highview of Northampton, a skilled nursing home and rehabilitation facility. Quoting here from Greta's reporting, Highview is one of the most fined facilities in Massachusetts by the federal government in the past 3 years. It has not met state standards for registered nurse hours and has well above the national average of health citations. The story goes on to say current and former residents who spoke to the Republican described a facility that neglects patients and provides poor care. Greta, what gave you the idea to look into this?
Good question. Yeah, we got a tip and of someone who goes in there regularly, who went in there and suggested we look into it. And I found, complaints filed with the city health department that the heat had gone out in the spring, and numerous complaints. And so started looking into it and looking at some of that federal data of fines and reports. There's a lawsuit from the Attorney General's office that they settled, or sorry, not a lawsuit, a sort of settlement agreement about treatment of people with substance use disorder. And yeah, just talk to people who live there who have a lot of issues with how it's run and with what they say is really poor treatment and care.
And because of the conditions, they were fined $363,000 by the federal government in the past 3 years, making it the most fined nursing home in all of Western Massachusetts, the 9th highest in the state, according to your reporting. Looking elsewhere in Western Mass, though, Vantage at Wilbraham was fined almost as much money. And then Pioneer Valley Health and Rehabilitation in South Hadley, which we will talk about in a few minutes, they were also fined $338,000 there. What has the facility that owns Highview said about the problems that you were raised in your reporting and these series of fines?
Yeah, so Athena Healthcare Systems runs Highview of Northampton, as well as a number of other similar facilities across Massachusetts, Connecticut, and Rhode Island. They recently transferred ownership in Connecticut of several homes. They didn't answer many specific questions I asked under the guise of we can't sort of comment on specific people's cases, but they defended their care and their facility, and we'll see what comes next.
Rob or Peyton, thoughts on when you read this reporting?
Yeah, I mean, personally, I was horrified by what Greta uncovered was going on at this Northampton facility. And if you look at, Pioneer Valley Health and Rehabilitation Center in South Hadley, where 119 people have been left basically to their own accord, where staff was being unpaid. They literally ran out of supplies. There was over 100 people in the affluent community of South Hadley sitting in this nursing home on sweltering hot days without supplies, to the point where Bob the bike man Charland received a phone call, and he drove up there with pallets of supplies. He literally brought them toilet paper. When he arrived, he found people laying in their beds without diapers on who were incontinent. He found a horror scene. And I have to tell you, once a reporter, always a reporter, right?
Yeah.
So last night I started making calls on this, which is not my job anymore. But when I see injustice
you just
like
can't
this,
kick it.
I cannot. And because to me, in 2024, in Massachusetts, in South Hadley, give me a break. We have to do better.
Well,
we have to do better.
And State Senator Jake Oliveira and State Representative Dan Carey requested a formal investigation this week. This was reported by the Republican, the Daily Hampshire Gazette, and NEPM. They alleged unpaid wages, deteriorating and unsanitary working and living conditions, as well as financial mismanagement. Here's part of what Senator Oliveira said.
Horror stories of employees using pillowcases to wipe and clean surfaces. And when you hear stories of private philanthropy having to collect supplies and give them to the employees of that healthcare facility, it's horrific.
Peyton North.
I mean, it's disgusting. And really, it comes down to the checks and balances. Didn't we learn our lesson at the Veterans Home in Holyoke just a couple years ago? The leadership there wasn't being checked. It wasn't necessarily strong leadership, and it led to catastrophic circumstances. These are people who are coming to these facilities. Their family is trusting that they're getting taken care of, and they're not getting the care they deserve, or frankly, the care that they're paying for.
Yeah, and I should say that Blue Point Healthcare, which is the owner and operator of Pioneer Valley Health and Rehabilitation Center there in South Hadley, has not returned requests for comments for the Republican or NEPM, as far as I knew, according to the reporting that came out earlier this week. Greta, you and April Munford pointed out in your reporting that this business has gone through a variety of operators in just a few years. Panel, does that make you think that this is having an impact on the quality of care, this consistent turnover?
I mean, I would say absolutely. From what I understand, the current ownership was 3 well-intended investors who did no background in this type of care. And obviously they've, hit a brick wall with this. What makes me sick as a citizen and a recovering journalist, as you say, is the fact that it took this state so long to step in. And I don't need politicians calling for investigations. I need action. There's people literally suffering as we sit. And to me, that's unacceptable. The Office of Health and Human Services finally did dispatch the rapid response team, which is nurses, CNAs, basically, an emergency team. You saw them dispatched in some healthcare facilities during COVID. It was the same type of thing. They basically pay traveling medical personnel to come in and care for the people. To me, it's just unacceptable that people are left to lay while we politic around. So I strongly encourage the folks that are still within the journalism industry, please stay on the story. And you call the governor and you ask her for comment. You call the attorney general and you ask them for comment. You look at their public schedules. You chase them around the state. Do not let anybody off the hook, because nothing like this gets solved without divisive action day after day after day after day.
And to Peyton's point about the Holyoke Soldiers Home, that's how we ended up with action in this area, is because of reporters digging in and saying that this process, what's happening here, they demanded answers, and it opened up, obviously, a much larger investigation. People tragically died, but also many people lost their jobs, and leadership was changed, and so that led to a lot of action. So more likely to come, obviously, on this issue. And now, in the great words of Monty Python, for something completely different, let's go for a bit of a mental palate cleanse, shall we? In Holyoke, years in the making, the efforts to bring the 1920s era Victory Theater are coming back and gaining life again. The Reminder, the Daily Hampshire Gazette, Mass Live, NEPM, among the folks who've been covering this story. Just a touch of backstory here. The Victory Theater opened in the 1920s. Essentially, it's been vacant, though, since the 1970s. In 2009, the Massachusetts International Festival of the Arts, or MIFA, as we all know it as, bought the site, and the boldly bespectacled artistic director Don Sanders has been pushing for this project ever since. Peyton, the Reminders, Trent Levakis took a look at this. Where do the renovation efforts stand right now?
So they're working on it. They're in the process. They seem to be making good strides forward, but it's a $71 million project, so it's going to take a while. But they're doing their best to maintain a lot of the currently installed fixtures. They have beautiful mahogany throughout. They have marble. They're really trying to maintain what they can, not only because it's expensive to replace it, but also that history is there.
Yeah, and I haven't been inside yet, but it looks stunning in there, even in its decrepit state. I mean, Tiffany glass windows, just they don't make them, as so many folks say, right? Like, they don't make them like they used to. It's just such a different space. And it's far from the first historic renovation that we've seen here in the 413, right? Go out to Western Massachusetts. We've seen the restoration of the Mahawi Theater in Great Barrington, the Colonial in Pittsfield. In Northampton, we've got the Kelvin, the Academy of Music. We have our own NEPM neighbor, the long-discussed Paramount. and those 2000s club goers like myself, known as the Hippodrome, but the Paramount Theater for all intents and purposes, right? And Sanders pointed out that this theater will be unlike any other in Western Massachusetts, and I'm quoting from the reminder here, we're in a sector of the country where there is no theater that can house this kind of tourism, so we're not only missing out on the entertainment fun, but the economic benefits, Sanders said. It also opens up the possibility of creating shows here, and the one thing you have to have is the means of production to do that. He also said that this could go on to rival the economic impact that Tanglewood has had on the Berkshires. So like Victory Theater will be to this section of Western Massachusetts as Tanglewood is to the Berkshires, is the idea there. And for fun, I pulled the stats, and it's an older one from 2017. And then the economic impact was found to be $103 million. So we are not talking about chump change here, if and when this rolls out. Do you think that's been part of what has helped this be a lasting project? Because it's been 10, 15 or so years in the making, and initially had a price tag of $61 million. We're now at $71 million.
Yeah, I think the determination of the community to make this happen and come to fruition has been a driving force. That and the creativity in procuring funds. The difference between this project and the Paramount Theater next door is, I think, ownership. It's the community's stake in the project, and it has been them playing the long game and saying, this is the potential positive impact. Please support us. They've done everything from grassroots fundraising to lobbying the legislature, working with within the context of art grants. The Victory Theater groups, they've done a fantastic job.
There's even some COVID relief money. I think it was about $2 million that Mayor Josh Garcia appointed for this. So lots of different ways that they're trying to crack this nut, as some people say. But I also think that MIFA has been clever in that while they don't have the space that they want to have, right, this grand 1,600 seat theater there in downtown Holyoke, they do pop-up performances. They've had performances elsewhere in Holyoke that I've been to. And I think that's a smart and creative way to say, hey, look, here's the type of production, the caliber of the work that we're going to bring to the region, only it's going to be huge. It's going to be so much bigger. It's going to bring these Broadway touring shows that we see in Hartford, but don't quite make it here because we don't have the rigging, we don't have the seats. There's so many things that we don't quite have yet that could support things like this. So I think it's going to be fascinating to watch where this goes. And I certainly hope for the sake of the project, victory will be theirs. There's a poster out front of the theater that says victory is ours. So I think certainly Don Sanders and their team are putting it out there. All right, let's move on to our prediction, scoops, and praise portion of the show where we ask our panel to make a prediction about the news, dish about a story they're working on, or heap some praise on a newsworthy nugget. I'll start with you today, Rob Rizzuto.
I think I'm going to circle back to the presidential race. I think that as early as this weekend, you may see President Biden bow out of the race. After everything that's happened, now he's been afflicted with COVID again. I think that there's, that if you read the tea leaves, I think you'll be seeing him bow out. I think Kamala Harris will, rise with probably a couple other people. They'll sort it out at the convention. And I think that just the way the path has been set, you will see Donald Trump as the next president of the United States.
Greta Yoakum. Ooh, bold. Even went for the presidential there, Robbie. You stunned me at the end. Greta, prediction, scoop, praise?
Yeah, I'd love to give some praise to one of our summer interns, Sam Paul at the Republican, who has done some reporting on the Pioneer Valley Health and Rehabilitation and the issues going on there. So shout out to her.
Great work that interns are providing across our newsrooms here in Western Mass. They're the journalism folks of the future. Peyton North.
So a little scoop, Stanley Park in Westfield is actually celebrating their 75th anniversary. It's very exciting. They have a celebration. And in the August 8th edition of the Penny Saver, which is our reminder product that goes to Westfield and Southwick, we're going to have a special section that's celebrating them and their history. And it's going to be really beautiful. So highly recommend going out to Stanley Park and celebrating with them.
Summer fun right there in Westfield. That's fantastic. My prediction this week builds on a bit of what Rob Rizzuto says. I, too, think that we will see sometime in the next week President Biden saying time for him to step down. But I think that Pittsfield will end up making national news because of it, because we are going to see Vice President Kamala Harris in Pittsfield next week. And I think that she will be then the presumptive nominee, and Pittsfield has the opportunity to be making some big bad news. You heard it here first on the Rundown. My thanks to this week's Rundowners: Greta Yoakum from the Springfield Republican, Peyton North, the executive editor of Reminder Publishing, and Hampden County Sheriff's Office Senior Public Information Officer Rob Rizzuto. The Rundown anthem is by the Love Crumbs. Our director is Tony Dunn. Our board op is Phil Bishop. Our engineers are Betsy Langto, Mark Rakin, Kara Foster, and Chuck Dubé. Additional team support provided by John Sutton, digital from IU Surya Wan. Remember, email us therundown@nepm.org. I'm Carrie Saldo.